Hello, everyone. My name is Robert, and this is my presentation on the status of AIDS around the world. Among the choices presented, I decided to focus on the Democratic Republic of the Philippines. Here, we will be discussing basic geographical information and then move on to HIV infection trends and AIDS-related programs and interventions. The Democratic Republic of the Philippines is located in Southeast Asia and is a sprawling archipelago comprised of more than 7,000 islands. Its capital is Manila, with a population of 1.7 million, followed by other major cities distributed all over Luzon, Visayas, and Mindanao. Overall, the Philippines has a population of more than 90 million people. With an annual growth rate of 2%, it is one of the most populous and fastest growing countries on earth. The country is predominantly Roman Catholic, has a very high literacy rate at 95%, and has over 180 languages and dialects. As to their economy, the Philippines has been growing at an average of 5% annually since 2000. According to Morales, the number of HIV cases in the Philippines has risen to approximately 18%. The most common mode of transmission of HIV, according to the HIV/AIDS and ART Registry of the Philippines, HARP, is through sexual contact, especially male to male sex. Second is through the sharing of infected needles among drug users. Lastly, women living with HIV can also spread the virus to their children during pregnancy or lactation. There are more than 50 DOH designated treatment facilities in the country which provide HIV care. Some offer it for free, but others' paid tests can cost a little more than $1,000. According to the Republic Act 8504, or the Philippines AIDS Prevention and Control Act of 1998, all HIV testing facilities are required to conduct free pre and post testing counseling. RA 8504 mandates the promotion of HIV/AIDS awareness through a comprehensive nationwide educational and information campaign. Public and private schools are also required to teach HIV/AIDS prevention and control. Health officials have recorded an 18% increase in the number of new cases of the human immune deficiency virus, HIV, in 2016 compared to the year before. Of the HIV cases last year, 88% are asymptomatic or do not show the symptoms at the time of reporting, which may include fevers, chills, rashes, swollen lymph nodes, and mouth ulcers, among others, according to a U.S. government HIV/AIDS information website. According to the Department of Health, there were 9,200 Filipinos who tested positive for the virus, while in 2015 there were only 7,829. This brings the total number of people living with the PL-HIV in the Philippines to 37,653. KLJ Stamaria, head life coach of Love Yourself Incorporated, said that the increase in HIV cases did not necessarily mean more people had been infected. In a phone interview to CNN Philippines, she says, "This is both good and bad. Good because people are becoming more aware of AIDS and HIV and thus decide to get tested. Bad because some people have the virus for so long but were unaware until they got tested." Love Yourself Incorporated is a non-government organization which aims to prevent the spread of HIV and AIDS. It is one of the satellite clinics accredited by the Research Institute for Tropical Medicine, RITM, to provide free HIV testing. The Department of Health reported that in April 2017, 629 persons, most of whom are millennials, were diagnosed with the human immune deficiency virus, HIV. More than 80%, or 513 of those diagnosed with the virus, belong to the 15 to 34 age group. Out of the 609 who acquired the virus through sexual contact, 343 or more than half are men who have sex with men. Meanwhile, 18 individuals were reported to have contracted the virus through the sharing of infected needles. There were also 2 reported cases of mother-to-child transmission. In June 2017, 17 people have so far died of HIV-related complications, bringing the total number of HIV-related deaths this year to 172. In a statement, National Party List Representative Neil Abbayan said that this data is alarming. These figures are clear proof our country needs better education of the Filipino youth on how they can care for their sexual health, he said. Abbayan also said that HIV and AIDS prevention campaign should be intensified, not just in schools, but also in the workplace and even at the community level. That would be all for this presentation. Thank you for your attention.